Now, in this session, we are going to discuss here another division, another branch of the trigeminal nerve, that is the maxillary nerve. As you know, we have discussed previously, the trigeminal nerve is the fifth cranial nerve. And if you remember trigeminal nerve, because it is supplying the muscles developing from the first pharyngeal arch, that means it's a mixed nerve. When it's a mixed nerve, means motor supply or the motor fibers of the trigeminal nerve, which in fact are supplying the muscles of mastication and some other muscles also, will be mixed with the sensory fibers. And we know already that the sensory fibers which the trigeminal nerve carries, they are the general somatic efferent fibers, because trigeminal nerve, we have labeled this nerve as the queen of general somatic sensory signals. General somatic sensory signals from all the face up to vertex, you see half of the scalp, and you see entire face, and some parts of you see 2/3 or half of the cavities which will in fact continue from the surface. So that means this nerve is carrying two components here. We have already discussed the trigeminal nerve, and we have in fact caused three divisions emerging out of it. And you know that the trigeminal nerve, see here, is emerging from where? The trigeminal nerve, this is emerging here from, or it is attached here to the pons area, that is the upper pons or the mid pons area here, in form of a larger sensory root that you are actually watching. Larger sensory, why? Because all three divisions of the trigeminal nerve, they will carry the sensory fibers. And the cell bodies which in fact are present here in this ganglion, that is called trigeminal ganglion, which contains the fibers. These fibers are these are the neurons which are pseudo unipolar neurons. You see, this is called cell body, has the one axon. Peripheral axons will travel along with their nerves, and central axons will actually travel here in the single root that enters the pons here, where second order neuron cell bodies are waiting, and they will relay into them. This is now the function of the second order neurons, to send these signals to the higher centers, that means to the thalamus, in form of this time the tracks here. These will be the ascending tracks here. But we are discussing here this is the root that is called the larger sensory root here, and this root in fact has the same ganglion, and this same, you see, that is a single ganglion that is actually called the trigeminal ganglion. And we have already discussed here this trigeminal ganglion that is lying here in a depression which is on the anterior surface of the medial tip of petrosport of temporal bone, in a depression that is being wrapped up by the dura mater. That's why this depression is called the Meckel's cave, which is extradural space here, and in this extradural space is lying this ganglion that is called the trigeminal ganglion. I am writing here TG. So here is the trigeminal ganglion. So here this is it, but at the same time we told you that we don't have just this, but we have got here a motor root also, and the smaller medial motor root is also present here. So it is a motor root also, and it is a sensory root. We will be discussing sensory root because this nerve, which is called the maxillary nerve, it carries just the sensory roots fibers only, because this is the purely sensory component of your trigeminal nerve, like ophthalmic previously which we did. Motor root, which is also available for the trigeminal nerve, containing special visceral efferent fibers. Why special visceral efferent? Because if it is a mixed nerve, special visceral efferent fibers must be present in it. Maybe other fibers also, but trigeminal doesn't carry any other types of motor fibers at all, except special visceral efferent fibers, because it's a mixed nerve, and mixed nerve essentially has special visceral efferent fibers for the muscles to innervate the muscles developing from pharyngeal arches. And here which pharyngeal arch? First pharyngeal arch, and this is the muscles of mastication and some other muscles also. And if you are actually discussing here, so motor root which is present there, but motor root will be totally and 100% it will be delivered to and will be distributed in the mandibular nerve, and mandibular nerve, that will be discussed in mandibular nerve. And if you are actually discussing in this, so we will be discussing here only the sensory root now, because the maxillary nerve carries all its fibers from the sensory root. And here is the maxillary nerve. Now you can see here, so maxillary nerve will start from where? It will start here from the trigeminal ganglion. From the anterior edge of the trigeminal ganglion, you see three nerves are emerging here. One nerve that is at the higher level, you see superiorly, we have discussed this nerve also, that is called the ophthalmic nerve. The second one, this is the maxillary nerve which we are discussing, and the third will be the mandibular. And our second one that we are discussing here is called the mandibular, this is called the maxillary nerve. And now this maxillary nerve which you are discussing here, this is the second division of your trigeminal nerve here. And the second division of this trigeminal nerve which we are actually discussing is having its cell bodies present here, pseudo-unipolar neuron cell bodies present here in the same common ganglion, that is called the trigeminal ganglion, that is lying in the Meckel's cave. From the anterior edge of this trigeminal ganglion, this nerve is emerging here. So our nerve starts from here. And when the nerve starts from here, you can see here this nerve is now running here and courses forward here. And forward means if it is from the tip of the pittus part of the temporal bone, medial tip of the pittus part of temporal bone on its anterior aspect from the Meckel's cave, if the fibers of the maxillary nerve they are running now, they will be running on the lateral side of this sella turcica, which is formed in the body of the sphenoid bone. On the side here there is a groove, and in the groove we have already formed in the previous class, we see that already formed here the cavernous sinus. And cavernous sinus, we told you that is actually having here a dura mater, that is called the fold of dura mater, that is called the diaphragm ocelli, that is passing over the groove in such a way that this dura mater fold will form its lateral wall and the roof also, and then it will cover the sella turcica or the hypophyseal fossa. But during its process, you see that during this journey, on the side of the sella turcica, on the side of the hypophyseal fossa, a sinus has been created. That sinus is called the cavernous sinus, that we discussed previously. This is here. Now in this diagram you are watching here, this is pituitary fossa where the pituitary gland is lying. This is your dural fold here, and dural fold has got this lateral wall and has the roof now on this side as well as on the other side. So here when the lateral wall was actually formed in the dura mater, it's a fold of dura mater, that is called the diaphragm ocelli, it's forming the lateral wall of cavernous sinus. So in the lateral wall of the cavernous sinus, one by one the nerves are passing here. Almost all of those nerves you see that which are in fact their destination is the superior orbital fissure, they are passing through that. But incidentally you see that the maxillary nerve which does not have the destination through or says exit through the superior orbital fissure, it is also passing through that, because its foramen, its exit foramen is lying just posterior lateral to the superior orbital fissure. So it will travel in the lateral wall of the cavernous sinus. In the lateral wall of the cavernous sinus, I told you that highest nerve, that is the superior nerve, it is the third nerve, that is called the oculomotor. Next nerve below that is called the trochlear. Then next nerve was the V1, that is called the ophthalmic division of the trigeminal nerve, and now it is passing V2, that is the maxillary nerve. Maxillary nerve, it is the lowest among the four nerves in the lateral wall of cavernous sinus. That's why the problem you see in the cavernous sinus or the cavernous sinus thrombosis or pressure in the cavernous sinus presses upon the lateral wall of the cavernous sinus, and it causes here problem in all these four nerves including maxillary. And here this is the maxillary nerve which is now running here in the lateral wall of cavernous sinus. You see that everything is running in the lateral wall of cavernous sinus. Cavernous sinus, you know that it is a kind of a spindle like sinus here, which has got the anterior pointed end and the posterior pointed end. The posterior pointed end, and it has got the belly which is a much thicker and wider belly here, and it is filled with the venous blood which is coming from the surface of the brain as well as from the eyeball. And if for example you are watching in this sense, so you can imagine that this will be actually like a spindle like. So anterior tip or anterior narrow end of your sinus ends at the medial end of your superior orbital fissure, and posterior narrow end will end here, or you can begin at the medial tip of the pittus part of temporal bone, and from its posterior end it will drain now into the jugular foramen. It will drain into the jugular foramen, into the jugular into the internal jugular vein. So it will pour its blood or drain its blood into the internal jugular vein. Okay, this is true, but one thing is that in its lateral wall is running now your four nerves, and the lowest one will be the V2, that is second division of the fifth nerve. This is the maxillary nerve which we are discussing. Now this nerve which you see that we are discussing here, that nerve is now, because all the nerves which are running in the lateral wall of cavernous sinus, their destination is superior orbital fissure, but this will be little short of the superior orbital fissure. After having made its journey through the lateral wall of the cavernous sinus, it will now be falling just short of the superior orbital fissure, and you see posterior lateral to superior orbital fissure in the floor of your middle cranial fossa. There is a rounded foramen, rotatory foramen, you call them foramen rotundum. You see this foramen rotundum. So, it will actually enter into the foramen rotundum. So, you can see this also. So, that means from anterior edge of your trigeminal ganglion, it will pass in the lateral wall of the cavernous sinus and enters here into the foramen rotundum. This was its intracranial course. Means in the intracranial course, important will be, it will have its cell body located within the trigeminal ganglion in the Meckel's cave. Means if the trigeminal ganglion has any problem, maxillary nerve will be affected, though mandibular and trigeminal ophthalmic division will also be. Then it is running in the lateral wall of the cavernous sinus. You see, very important relation with the cavernous sinus. Cavernous sinus thrombosis will lead here to affection. You will lead here to influencing the lateral wall of cavernous sinus. So, pressure will be there, and this will lead here to the problems with all these nerves, including the maxillary nerve. And then will be the exit point now. So, the intracranial course, and now the fissure foramen or canal or meatus, etc. Now, how it will get rid of the cranial cavity. So, exit foramen is foramen rotundum, very famous. This in fact gives a passage to this maxillary nerve. So, this maxillary nerve will at last gets rid of the intracranial course, the cranial cavity, the middle cranial fossa, and will enter into the rotundum. And with rotundum, I have told you there already that when the foramen comes, you will ask yourself 4 questions. Name of foramen, you know that it is foramen rotundum. Location, in the floor of the middle cranial fossa, in which bone? Obviously, it is on the lateral side, it is the greater wing of the sphenoid. So, it is in the greater wing of the sphenoid, it is forming the floor, so it is entering in that. This is another thing. And what 2 regions this foramen will communicate? Means if you are passing something through that, and this time who is being passed here, you see that is the maxillary nerve. Means when you are passing through that, you will actually be coming here under the base of the skull so medially that you will be actually coming under the base of the skull, and there is a fossa that is called the pterygopalatine fossa. Pterygopalatine, because if you will be little lateral and it will be interior through foramen ovale, you will come into the lateral fossa, bigger one, that is infratemporal fossa. But this time in the pterygopalatine fossa. Now your maxillary nerve has at last entered into the pterygopalatine fossa. So, it is the content of the pterygopalatine fossa. So, that means the student who is actually going to deal with now the maxillary nerve should have good knowledge about the cranial cavity, should have good knowledge about the pterygopalatine fossa anatomy and boundaries, etc. Because all the maxillary nerve branches in fact will be distributed within the pterygopalatine fossa, and they will get rid of the various walls within the pterygopalatine fossa, various walls which have the foramina. Just like in the medial side we have the foramen, on the lateral side we have the fissure, on the anterior side we have the fissure, in the roof say floor we have the fissure, and from the roof we do not have anything with the body of the sphenoid, but on the back side we have got the pterygoid plate, and the pterygoid plate is actually our pterygoid process. In the pterygoid process we have got this foramen, this is foramen rotundum. So, it is entering here from the posterior wall of your pterygopalatine fossa through this foramen rotundum to enter into, to be the property, to be the content of your pterygopalatine fossa here. And in the pterygopalatine fossa, when this nerve is actually coming here, you will see that in the pterygopalatine fossa almost 70% of pterygopalatine fossa capacity is being accommodated here by a ganglion, one of the very important parasympathetic ganglion, one of the 4 parasympathetic ganglion in your head. That is called the pterygopalatine ganglion. We sometimes call it sphenopalatine ganglion also. But it is a pterygopalatine ganglion which is composed of the cell bodies. Cell bodies means these are the neurons, cell bodies, multipolar neurons here. Have multipolar neurons, and from this multipolar neurons will emerge now your axon bundles in various directions here to form various nerves here, and they will be containing the parasympathetic fibers. Which parasympathetic fibers? The preganglionic parasympathetic, I say postganglionic parasympathetic fibers, but they must be stimulated by preganglionic fibers. We have to see from where these preganglionic fibers will come. We will come to this here later on, but we watch here our sensory fibers. Which sensory fibers in the maxillary nerve? You know that trigeminal, they are inheriting one type of fibers only. This is general somatic efferent fibers. So, maxillary nerve contains general somatic efferent fibers that she has inherited from the mother, that is the trigeminal nerve. So all these fibers which we are discussing, they are general somatic efferent fibers to different sites here. Still, this nerve has not given any branch yet. So you see that it is not giving any branch yet, but you see that before entering into your foramen rotundum, it will give you here a meningeal branch. And that meningeal branch, you see that is in fact is coming here back to supply the dura mater of middle cranial fossa. So first of all, the branch that it has been given, it has actually given this first branch that has been given off here. This is called the meningeal branch. This meningeal branch to the dura mater of middle cranial fossa. And then it enters into the foramen rotundum to be a part of now the pterygopalatine fossa. So you are entering into the pterygopalatine fossa. So within its intracranial course, so surely you will have to have a look at your cavernous sinus also. And you will have to watch this in the lateral wall of the cavernous sinus. And when you are actually coming here in this, you see this is a middle cranial fossa, and you are watching your trigeminal ganglion here. This is TG again. And trigeminal ganglion is giving 3 branches from its anterior edge. Ophthalmic we discussed later, as previously discussed ophthalmic nerve. This is the second nerve, this is the second division, that is the V2 we are discussing here. It is actually passing through the foramen rotundum. And the foramen rotundum, but I told you that foramen rotundum it has passed surely, but before that it has given here a meningeal branch. To what? Meningeal branch to the middle cranial fossa dura mater here. This is meningeal branch. Meningeal nerve, it is called the meningeal branch of the maxillary nerve, middle cranial fossa dura mater, and then it has actually gone through the rotundum to be a part of the pterygopalatine fossa here. Now see here in the pterygopalatine fossa it has entered. Watch in this diagram. See, this is now trigeminal nerve. You are watching this ganglion, trigeminal ganglion. Here is the cell body, pseudo unipolar. I am discussing only maxillary. Central axon is going in the root of sensory root of the trigeminal, but the peripheral axon is running in your maxillary nerve. So maxillary nerve is formed by the peripheral axon bundles of those pseudo unipolar neurons which are located in the trigeminal ganglion, forming a part of the trigeminal ganglion, obviously, because the remaining part is formed here by the mandibular and the ophthalmic cell bodies. And all of them are also pseudo unipolar, because you see that all the sensory modalities, the first order neuron of all the sensory modalities and taste also, they are pseudo unipolar. But those special senses which have the specific nerves, the olfaction, the vision, hearing and balancing, they have first order neuron, they are bipolar. So here they are pseudo unipolar, and this is actually here peripheral axons making a bundle, nerve has been created that passes through the foramen rotundum. This red color is the foramen rotundum. And now it is enters into pterygopalatine fossa here. Now in the pterygopalatine fossa, it will have a meeting with the pterygopalatine ganglion, and you are watching this blue color, this is pterygopalatine ganglion. We can write it pterygo P, palatine P, ganglion, this is PPG, this is the pterygopalatine ganglion. Nothing to do with the pterygopalatine ganglion yet, because it doesn't come here, it doesn't contain any parasympathetic fibers, periganglionic, so that they should actually go into the relay into your pterygopalatine ganglion, nothing to do. She is containing only what? She is containing only the fibers which are general somatic efferent fibers, general somatic fibers for the sensory purpose, here somatic sensory fibers only. And pterygopalatine ganglion is one of the parasympathetic ganglion. So it will actually get the relay from the periganglionic parasympathetic fibers, which the maxillary nerve doesn't contain. And you are actually watching here, so maxillary nerve is now running, and if you see this maxillary nerve which is running maxillary nerve here, 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 when the maxillary nerve reaches here in the pterygopalatine ganglion, I say pterygopalatine fossa, in the pterygopalatine fossa, we discuss here it is giving actually one of the largest branch here present in the pterygopalatine ganglion, as a pterygopalatine fossa, from where it is actually giving here this nerve. If you look at the anatomy of your pterygopalatine fossa, and if you are actually seeing here, and if you are standing in the pterygopalatine fossa, and if you look medially, you will see here a perpendicular plate of palatine bone. If you see laterally, you have got a fissure which will guide you into the infratemporal fossa, that is the pterygomaxillary fissure. If you look in the front, you have got the back surface of your maxilla. If you actually look at the back, you see you have got a pterygoid process which will come down here to become the pterygoid plates. So, we have got the anterior, we have got the posterior, we have got the lateral, that is the fissure, we have got the medial, that is the perpendicular plate of the palatine bone, and you have the roof that is formed here by the body of the sphenoid, and you have the floor. That is very important, because floor you see almost non-existent, in such a way that if you have got anteriorly maxilla, that is the back surface of maxilla, and posteriorly you have got the pterygoid process of the sphenoid bone, and usually you see that maxilla and sphenoid bone, they do not fuse with each other, but usually you see that here maxilla, pterygoid process and maxilla inferiorly they will in fact fuse here. They will fuse here. So, pterygomaxillary fissure direction, or you see its shape will be almost triangular. You can see this here. See, this is the pterygomaxillary fissure is this. You are watching this pterygoid process, this is pterygoid process, these are the plates here, and here you are watching this maxilla back surface, and here it is. You are standing here outside in the infratemporal fossa, and now you are watching through this fissure which is almost triangular, and if you pass something through this fissure, you have entered into the pterygopalatine fossa. Where you are watching this green color, this is the pterygopalatine ganglion, and you know that this is the foramen rotundum. As entering into the foramen rotundum means this is the posterior wall of your pterygopalatine fossa here, posterior wall that is formed here by the pterygoid process, and pterygoid process is the largest upper foramen. You have 3 foramina here in the pterygoid process. One foramen you know that is here, this is foramen rotundum. Next foramen is called the pterygoid canal, and the last will be the palatovaginal canal. So, here through the foramen rotundum your nerve has entered. It has gone here through straight here, you see that, nothing to do with the pterygopalatine ganglion, but it is in fact is going through this now, through the pterygopalatine fossa, till it will now enter here in the anterior wall. At the top of the maxilla there is a fissure that will guide it into the orbit here, and once it passes through this fissure, that is called infraorbital fissure, the name of this nerve will become infraorbital nerve. The terminal part of the maxillary nerves branch, the terminal part of the maxillary nerve will change its name to infraorbital nerve, and this infraorbital nerve has been, now you see this is entering into the orbit here, you see this. But here you see that when it is entered into the orbit, I told you that when it enters into the orbit, now here this is the rotundum, it enters into the pterygopalatine fossa, and when it enters into the orbit, its name will become now, you see its name will become, here its name will become now infraorbital nerve. So, this will be now infraorbital nerve. The continuation of the maxillary nerve. I mean, this infraorbital nerve is running where? Is running now in the floor of the orbit. Bony orbit anatomy will now come into play now. In the floor of the orbit, there is a groove, infraorbital groove. So, it is now here visible there. But you see that after that, in the next half of the floor, this nerve disappears here. The reason is that because a bridge of bone will come over it. So, that means groove is no longer, this groove is converted into a canal. This is called now the infraorbital canal. So, it will now be in the infraorbital canal. So, you see it will become dotted here, it will be hidden by the bone here. This is called the infraorbital canal here. And then it will now emerge here on the face here, just below the inferior margin of the orbit, there is a foramen, infraorbital foramen. So, it will come out of it now. This is now infraorbital nerves end, means maxillary nerve has ended here. The maxillary nerve has ended here, so it will become now cutaneous, and cutaneous in such a way that is forming here a huge bunch of twigs here. You see that will, some will go here to the skin of the lower eyelid as well as the conjunctiva, etc. And then some of the fibers will now come here over and will supply here the lip also, upper lip, and some of the fibers in fact will go here to supply here this lateral side of the nose also. A huge bunch of fibers of this infraorbital nerve will actually terminate like this. You can see this here. You see here this nerve, infraorbital, going here to the lower eyelid and supplying the conjunctiva as well. It is now coming here to the lateral side of the nose to some extent. It will going here to the upper lip also. You see huge bunch. This is called infraorbital nerve. This is the end of your maxillary nerve with a different name that is called infraorbital nerve. So with this you are actually doing some more parts of the cutaneous innervation of the face also. You don't have to count these nerves. You have to do the maxillary nerves branches, the cutaneous branch. You see cutaneous innervation of the entire face will be done, except here the angle of the mandible that will be supplied here by the brachial plexus, by the cervical plexus. Almost half of your scalp will be done. The rest of the scalp will be done here by the spinal nerves. So you don't have to count these nerves, which nerves are here, okay, this piece by this nerve, this. You don't have to count the nerves. You go and do all maxillary nerve. Many things will be actually covered here. Nasal cavity nerve supply will be covered, palate nerve supply will be covered, pharynx nerve supply will be covered. You see the teeth will be supplied here, skin of your face will be supplied and your scalp will be supplied. Don't take them separately. Do the nerve by itself. Catch the root now. You will see that all the things will be clear. And if you are actually watching in this, I told you that this infraorbital nerve has actually gone. So this will be the course now. This is the extracranial course of your maxillary nerve. Extracranial course of your maxillary nerve was this. So this was the extracranial course of maxillary nerve. Means extracranial course of maxillary nerve means after the rotundum, extracranial course means into what regions you have crossed. What regions? 3 regions basically. Number 1, pterygopalatine fossa, means the boundaries of pterygopalatine fossa have to be cleared, have to be understood properly, because through this fossa your maxillary nerve is passing. Then because in the anterior wall at the top, where the anterior wall and the roof, they are in fact touching each other, because anterior wall is maxilla and the roof is the sphenoid and they don't talk with each other, there is a gap. If there is a gap, long gap is there. Long gap whose 90% of this gap was present in the infratemporal fossa and 10% gap is present similarly uninterruptedly inside also in the pterygopalatine fossa. This is called inferior orbital fissure. So this nerve enters into the inferior orbital fissure. Once it enters into the inferior orbital fissure, I told you that its name will change to infraorbital nerve. Where it should run? Obviously the floor is being formed here by the maxilla and she is the maxillary nerve, so it will be running on the floor. Initially in a groove, later on in the canal. So orbit boundaries, bony orbits boundaries should be done also. So the second region in which the extracranially it is actually running, it is important again. And the third will be from infraorbital foramen, it is actually coming out, so face you should have some idea about. This is the extracranial course through which is in fact is going through. Now in its entire journey now, it is giving now the branches. We have told you that whenever you take any cranial nerve, it should be actually done under certain headings like introduction. You see it is a general sensory nerve for the somatic purpose, for the somatic sensations from the sides, for example from the nasal cavity, from oral cavity in the palate here, upper teeth, this and that. You should have general knowledge about, informally about the maxillary nerve. And it is one of the divisions of the trigeminal, second division. That's why it's called V2. Then its name, you have seen the maxillary. Then its number, you see V2. Why we are calling it V2? Why V? Why V means the fifth? Because it is the second division of the fifth nerve. That's why we call it V2. It's the official number of this nerve. And after that, its attachment. RJ attachment is of the trigeminal, not of this. But you can say it starts from where? Attachment means it is attached here to the anterior end of your trigeminal ganglion. So say something about trigeminal ganglion. It's a shape of its neuron or morphology of its neurons. This nerve is composed of what? See, functional components. Functional components means it doesn't have its own personal components. This is actually having a share of the trigeminal components, and trigeminal is the mixed nerve, and it has got special visceral efferent fibers and general somatic efferent fibers also. Why? Because she is very famous general somatic efferent nerve. She is the queen of general somatic efferents. This will be there, and because it's the mixed nerve, special visceral efferent fibers must be present in the mixed nerve essentially. Maybe some other motor, but here no motor, even if it may be some other motors in other mixed nerves, but this will be there, because mixed nerves always we remember through the pharyngeal arch muscles here. They are innervating the pharyngeal arch muscles essentially. So that will be essentially also, because it's containing only one, so it is containing only one motor component. So this motor component must be there, essentially is present there. Additionally, it can carry other, but doesn't carry any other motor fibers at all. Though we have got even general visceral efferent autonomic fibers also, but she is not carrying any autonomic fibers. We have general somatic efferent fibers for the skilled, highly skilled muscles, but highly skilled muscles are only specified for purely motor nerves. So now it has entered into the pterygopalatine fossa, where you have to see the boundaries of pterygopalatine fossa, study them. We have discussed that in a separate class. Now, in this especially, when you are actually discussing here, maxillary nerve is passing through the pterygopalatine fossa. When it's actually look at here, it's a medial wall of the pterygopalatine fossa that is formed by the perpendicular plate of palatine bone. At the top of the perpendicular plate of palatine bone, where it is about to become continuous with the roof that is formed by the body of sphenoid, here there is a triangular hole, you see. At that triangular hole, if you are actually passing something through the triangular hole, you will come here into the nasal cavity. Which wall? Lateral wall of nasal cavity. And if you are running into the lateral wall of the nasal cavity, you will see that with the lateral wall of nasal cavity through this foramen, because this foramen is between the sphenoid bone and between the two processes of the perpendicular plate of the palatine bone, anterior process that is called the orbital process, posterior process that is called the sphenoidal process. And here above the sphenoid bone, so there is a triangular gap, a foramen. That foramen is called the sphenopalatine foramen. And if you are passing something through the sphenopalatine foramen, you will come into the lateral wall of the nasal cavity, because here this is the medial wall of pterygopalatine fossa. So this will be common, in common, it will be the lateral wall of the nasal cavity. So you are actually passing here a nerve. You see, we are counting here. The first branch coming from your maxillary nerve is this. Foramen's name, sphenopalatine foramen. Location in the medial wall, at the top of the medial wall of the, you can say, of the pterygopalatine fossa, of the medial wall of pterygopalatine fossa, that has been formed here by a perpendicular plate of the palatine bone. And here incidentally it will be the in the lateral wall of the pterygopalatine as a lateral wall of the nasal cavity. So here this communicating two regions here, pterygopalatine fossa with the nasal cavity, and structure passing the nerve. Which nerve? A branch of your maxillary nerve that is called the sphenopalatine nerve, that actually enters inside. Once it enters inside, a very important thing, because it is actually supplying most of your posterior part of the mucosa of the nasal cavity, and immediately it splits up into two. One branch runs on the lateral wall through which it has entered, and one branch that will go here to the medial wall. A medial wall, you know, that is formed here by the nasal septum, bone of the nasal septum, that is called the vomer bone. It is making a groove here in the vomer bone and supplying here the mucosa overlying also. And then it is going obliquely down here to touch the floor of your nasal cavity, and you see floor of the nasal cavity is the same as the roof of your oral cavity. Why don't you call it hard palate? So see this nerve which we are showing you. Which one? Sphenopalatine nerve, a branch of maxillary nerve given within the pterygopalatine fossa, and getting rid of the pterygopalatine fossa to enter into the nasal cavity, through which you will be actually knowing the some nerve supply for the sensory supply of nasal cavity also. You will not just count here sphenopalatine nerve, you will see here what is sphenopalatine nerve, how it reaches there. You see that. So if for example you are watching in this, I told you that here is the sphenopalatine nerve. Now you can see this sphenopalatine nerve in this diagram. Now watch it here. See this triangular foramen which I am showing you. This area which we have actually separated anteriorly is maxilla, behind is the pterygoid process. We have separated the pterygoid process to show you entire open pterygopalatine fossa here. In this pterygopalatine fossa, where you see the medial wall, and I'm telling you here medial wall, this medial wall, triangular gap in the medial wall, this is sphenopalatine foramen. So this one is called the sphenopalatine foramen, this one. This is sphenopalatine foramen, and this is sphenopalatine foramen. You see that when a nerve emerges from where? This nerve emerges here from your maxillary, and this nerve emerges from the maxillary, enters into the pterygopalatine, say sphenopalatine foramen, and now it enters into the nasal cavity. And in the nasal cavity, it gives one branch that is lateral branch running here on the lateral wall of the nasal cavity to supply of your nasal cavity general sensation, not the special. The special is for the olfactory, that is in the roof, but here in the lateral wall. But the second branch you see it is running now as making a groove on the septum. Septum is formed here, a bony septum is formed here by the vomer bone, and it is actually forming the septum, and obliquely is running and coming down here very close to the floor, and floor you know that is actually this, and floor is formed here by the hard palate. Palatal processes of maxilla is forming most of the hard palate and hard palate is something which is separating the nasal cavity from the oral cavity. And here you know that it is now running. So your sphenopalatine has the two branches here. One branch you know that this is running on the lateral wall, but the second branch which is actually coming closer here to your floor in such a way that the most anterior part of the floor there is a foramen. And when it reaches here in the midline, in the foramen here, in the floor of your nasal cavity, right at this place, a nerve from other side is also coming. This nerve is very important. This nerve's name is the nasopalatine nerve, a branch of sphenopalatine. So in the midline, both the nasopalatine nerves, they come here and they join, and they both will pass through this foramen. Foramen is the most anterior part of the floor of your nasal cavity, which incidentally is the roof of your oral cavity also. And through this foramen, this nerve now is entering here. This foramen, which is lying in the most anterior part of your hard palate, which is actually developmentally as a junction between primary palate and the secondary palate. There is a fossa that is called incisive fossa. We call this foramen as the incisive foramen. We sometimes call it the nasopalatine foramen also, but this is called the incisive foramen. So this foramen, which is actually given here, this is called the incisive foramen. Incisive foramen, name incisive foramen. Present here in the most anterior part of your palate, communicating the nasal cavity, most anterior part of nasal cavity with the most anterior part of the oral cavity. Passing, the thing that is passing through is the nasopalatine nerve. If the nasopalatine nerve is present here and then coming here, you can say this nasopalatine nerve will reach here to the most anterior part of your hard palate. So the gingiva, or you say gum, very close here to the anterior part of your hard palate, that is the gingiva related here to the incisor teeth, they are actually supplied here by nasopalatine nerve, maxillary nerve. And if this is now branch number 1, which branch? I told you that this branch is called the sphenopalatine. So passing through sphenopalatine foramen, so this will be sphenopalatine nerve. I am writing it nerve, and this is sphenopalatine nerve passing through. Yeah, this is the one branch here. Your nasal cavity, most of the part, even little part of your oral cavity has been supplied. Then the same nerve, this is the maxillary nerve, being within the pterygopalatine fossa, it is sending here a branch that will return back here, so it will strike the posterior wall. Same posterior wall whose biggest upper foramen through which it has itself entered. And you know that after this foramen, that is on the back wall, that is the pterygoid process, this foramen rotundum, below that we have two more foramina. One foramen which is below the foramen rotundum, that is called the pterygoid canal, still below that is another foramen, that is name is the palatovaginal canal. So this will be the palatovaginal canal. You are watching this is the palatovaginal canal. See, this red color is palatovaginal canal. Second branch I am actually giving here. This is palatovaginal canal. Second branch I am actually giving here, and this second branch is the palatovaginal canal that is passing through this, and when it is passing through this now branch, this will enter here at the base of the skull in the nasopharyngeal area. So we can call this nerve as the palatovaginal nerve, but now its name is not palatovaginal nerve, its name is the pharyngeal nerve. So palatovaginal canal, here nerve will be pharyngeal nerve. Which pharyngeal nerve? Which pharynx? Obviously highest part of pharynx, that is called the nasopharynx. So nasopharynx and much of the part of nasal cavity and a little part of your oral cavity palate has been supplied by the maxillary nerve until now. Okay, then you will see that it is now sending in the floor, it is sending now two more branches. Now in this floor it is sending two more branches, means if you are actually sitting here in the pterygopalatine fossa, anteriorly you have got the maxilla, posteriorly you have the, superiorly you have the body of sphenoid. From body of sphenoid is emerging your pterygoid process like this, and pterygoid process is becoming pterygoid plates. Inferiorly, otherwise the pterygoid plates basically are the parts of sphenoid bone, and here is anteriorly is the maxilla. They don't talk with each other, but most inferiorly, hardly 20% their area they are fused here like this. When they fuse here, so this will actually narrow will be your floor. Means if you are standing inside the pterygopalatine fossa, you can't actually stand on your 2 feet here. You have to actually be on your 1 foot because it is very narrow floor. due to the fusion of the back wall with the anterior wall. It does not have a separate bone here, it is actually the fusion. And in the fusion, you have actually two foramina here. Anterior bigger foramen, greater palatine foramen, and posteriorly smaller foramen, lesser palatine foramen. So, if the maxillary nerve is actually passing in the pterygopalatine fossa, from its inferior aspect it is sending two branches down here, one in the greater palatine foramen, one in the lesser palatine foramen, with the names of same names like those of the foramina here. Watch this now. Two nerves which are actually bringing themselves out of your inferior wall, you say the inferior part of your maxillary nerve. Now, thing is understand, if for example you are watching here, this is now one nerve, this is another nerve. You see here is a big foramen, here is a smaller foramen. Now this, see this big foramen, it is called the greater palatine foramen. And through this foramen what is passing? Same nerve is passing. This is called the greater palatine nerve. And when this greater palatine nerve is actually passing, now watch this, it is now running on the under surface of the palate, hard palate, till it reaches here anteriorly until the incisive foramen. And from incisive foramen is emerging now the combination of the two nasopalatine nerves, and they will mix together here to form the plexus here. So, interior part of your palate is being supplied here by the junction of the two nasopalatine nerves, and here it will be the two greater palatine nerves, they are actually reaching there also. So, your hard palate mucosa and gingiva and all things have been actually supplied here by the greater palatine nerve. So, what about the lesser palatine nerve? The lesser palatine nerve is actually here is passing inferiorly from your maxillary, and it is entering here through the lesser palatine foramen, and is going backward here to supply the mucosa of your soft palate. Soft palate means your oropharynx, means most of your upper part of your oral cavity, and the back part, that is the soft palate, means oropharynx supplied by the maxillary. Your nasal cavity most of the part, and back side here nasopharynx through your pharyngeal branch has been supplied by maxillary nerve via these four major branches here. Okay, these four major branches they have supplied, no doubt. But you see here not only this, but you will actually be watching in such a way that these branches are there, but these branches are not directly coming from the maxilla. Four branches: the pharyngeal branch through the palatovaginal canal, sphenopalatine branch through the sphenopalatine foramen, greater palatine nerve through the greater palatine foramen, lesser palatine nerve through the lesser palatine foramen. These are the branches of surely of the maxillary nerve, but they do not arise from the maxillary nerve directly. So, what is the problem? What is the trick here? It is not passing, they are the branches of maxillary, but they are not coming out of the maxillary. Actually, what happens when when your maxillary nerve has entered into the pterygopalatine fossa, it is giving 2 to 3 branches, you can say 2 branches here to pterygopalatine ganglion. This is why pterygopalatine ganglion? Pterygopalatine ganglion is a parasympathetic ganglion. Maxillary does not contain any parasympathetic fiber. So, why she is actually going there? These two nerves which have entered into the pterygopalatine ganglion will not relay into the cell bodies of pterygopalatine ganglion. These are called communicating branches, or you can call them pterygopalatine branches of the maxillary nerve. Consider for a while, these are the two branches. Each of these two branches contain 100 fibers each, you can say. So, totally 200 fibers are entering in the two bunches, each of 100 fibers they have entered into the pterygopalatine ganglion, not for relaying purpose. So, you can say if the pterygopalatine ganglion, 2 branches enter now. If the 2 branches enter, from the other side, these branches 2 are not leaving, 4 are leaving. Means each branch will contain, consider 50 fibers each. Means these will be the fibers which are getting passed after the pterygopalatine ganglion. So, pterygopalatine ganglion has been supported only, no relaying at all, because these are sensory fibers. And sensory fibers, if the cell body is present in the trigeminal ganglion, why here they will actually be relaying? They are not relaying there, they are not parasympathetic. Who will relay there? Here will be relaying will be of the periganglionic parasympathetic fibers. Maxillary doesn't contain any single periganglionic parasympathetic fiber. So why it has dared to go into the pterygopalatine ganglion? To just give the support. How many fibers they have entered? The bunch of 100 each, you see there 200 fibers they have entered, for example. And when they are actually coming out here from all directions, 4 nerves are emerging now. 2 are connecting and 4 will be emerging, and each will contain 50 fibers, for example. And one of them will enter into the sphenopalatine foramen. This is sphenopalatine nerve with the 50 fibers here. So this sphenopalatine nerve, though it is the part of the maxillary, but it is not coming out of the maxillary directly. These are called the sphenopalatine branches of the maxillary nerve. I say sphenopalatine branches. Why? Because it is you can say pterygopalatine branches of because sphenopalatine is the other name of the pterygopalatine ganglion. It is called the pterygopalatine branches of the maxillary, not of the maxillary directly. They emerge from the other end of pterygopalatine ganglion. One will be the sphenopalatine nerve through the sphenopalatine foramen. One will be pharyngeal nerve through the palatovaginal canal. One will be down in the greater palatine nerve through the greater palatine foramen, and one will be lesser palatine nerve from lesser palatine foramen. But surely their sensation will pass through the pterygopalatine ganglion, will join the maxillary to go here to the trigeminal ganglion through the trigeminal sensory route to enter into the pons. Okay, because it is the maxillary is doing all these things here, but because pterygopalatine ganglion has intervened, that is why we call them pterygopalatine branches of the maxillary nerve, because they emerge from pterygopalatine ganglion. But these are not the only branches of your of your maxillary nerve within the pterygopalatine fossa. These were those 4 branches which in fact will be coming out of the pterygopalatine ganglion via communicating branches of your maxillary nerve. But without communicating branches, direct branches are also there, and there are 2 very important direct branches here. And these 2 direct branches will be actually emerging from, and I have given these 2 direct branches in black color here. These are original, you can say they are direct branches of your maxillary nerve. Look at them, it is very important branches. These 2 direct branches which emerge from your maxillary nerve, both of these branches will in fact leave the pterygopalatine fossa. This time you say, sir, from which foramen? From medial side sphenopalatine? No. From back side we have rotundum, palatovaginal? No, obviously occupied. Inferior side we have got the greater palatine, lesser palatine? No, because we have already occupied them. Actually it will run here through the lateral wall. There is a fissure which will guide them into your infratemporal fossa. Which fissure? Pterygomaxillary fissure. And out of this, one branch that will now leave the maxillary in the pterygopalatine fossa, leave the pterygopalatine fossa through the pterygomaxillary fissure to come into the infratemporal fossa, and when it comes into the infratemporal fossa here, and we are seeing all the boundaries of your infratemporal fossa. Inferiorly, when it is actually looking at, you see the back surface of your maxilla, and the back surface of maxilla there are 2 foramina. These are called alveolar foramina. So this nerve which we have actually got rid of the pterygopalatine fossa through pterygomaxillary fissure to come into the infratemporal fossa, in the anterior alveolar foramina it has entered. When it is entered in the alveolar foramina, you see that entered into the alveolar foramina, it will come here in the maxilla, and in the maxilla there is a hollow sinus, air sinus, that is called the maxillary sinus. So it will enter into the maxillary sinus. And when it enters into the maxillary sinus, you see the maxillary sinus floor, it is actually the hard palate. And from hard palate is emerging now, you see the teeth here. Which teeth? Most posterior teeth, molar teeth here. So these branch, that the branch we have told you here, it actually will give branches here to the roots of your posterior teeth, molar teeth. That is why this branch should be called as superior dental nerve. Nowadays superior alveolar nerve this is called now. Superior alveolar, full superior? No, on the most posterior part of the superior, most posterior teeth, these are called molar teeth. That is why this is called the posterior superior alveolar nerve. Very important nerve that is passing through the pterygomaxillary fissure. So pterygomaxillary fissure transmits not just the last part of maxillary artery, but is actually passing and giving a transmission to the posterior superior alveolar nerve. This is the posterior superior alveolar nerve that is supplying here the branches here. This is the course of your posterior superior alveolar nerve. Okay, the This was the one branch. What about the second? The second direct branch which comes from the maxillary nerve, again shown in the black. And this is the nerve which is actually leaving again the maxillary nerve, passing through the same pterygomaxillary fissure, coming into the same infratemporal fossa. And in the infratemporal fossa, when it's look on the anterior surface, it is the maxilla, and you know that when the maxilla finishes here, roof starts, and roof is formed here by the greater wing of sphenoid. In the infratemporal fossa, there is a gap because sphenoid and maxilla, they don't talk with each other, a big fissure. That fissure, if we pass something through the fissure, you come into the orbit. Why don't you call it inferior orbital fissure? So this nerve which I am actually telling you, left the maxillary within pterygopalatine fossa, passes through the pterygomaxillary fissure, surely comes into the infratemporal fossa, is passing through the inferior orbital fissure, and is passing through inferior orbital fissure to come into the orbit, being a content of the orbit, because it has gone more laterally, so it is running on the lateral wall of the orbit, and lateral wall of the orbit is mostly formed here by zygomatic bone. That's why the nerve's name is zygomatic nerve. This is called the zygomatic nerve. Okay, zygomatic nerve has entered, okay, no problem. In the orbit, it is the content of the orbit. But when it reaches here, it has to come outside because it is cutaneous. When it is actually coming here on the lateral wall of your orbit, in the lateral wall of the orbit in the zygomatic bone, there are two canals, there are two foramina. It enters through these foramina, and when it enters through these foramina, there are the canals basically, which have got the exit points outside in the body of the sphenoid. One very close to the face, one very close to the temple. So these are actually, so zygomatic doesn't actually come by itself, it is in fact splitting into two. One passes through this foramen which is closer to the temple, that foramen is called the zygomatico-temporal foramen, and there is another foramen which is coming closer here to the face, that is called the zygomatico-facial foramen. And these two foramina will give here emergence to the two nerves here with the same names. Zygomatico-temporal nerve, and this will be the same name, that is called zygomatico-facial nerve. And the zygomatico-temporal, facial will actually pass here and will supply here the skin over your cheek. You see this here, this one. This is the zygomatico-facial nerve. And another will be very close to temple, that will actually pass very close to the lateral canthus of your eye here. That is called zygomatico-temporal nerve. And this zygomatico-temporal, if you remember, very close to this lateral eyelid here, this area was your temporal, was your lacrimal nerve. This is a branch of the ophthalmic. So zygomatico-temporal and the lacrimal of ophthalmic, zygomatico-temporal of maxillary, V2, and this lacrimal of V1, they have the anastomos. They have actually the communication with each other. It's a very, very important communication, I will tell you later. So zygomatico-temporal nerve and lacrimal nerve, they are having anastomotic branches with each other. So that the zygomatico-temporal, if some important thing is present in the zygomatico-temporal, through that anastomotic branch can hand over it to the lacrimal nerve. Now these are actually the postganglionic, very important postganglionic parasympathetic fibers to the lacrimal glands reach like this, present on zygomatico-temporal. But zygomatico-temporal come from zygomatic, so they are present on zygomatic, and zygomatic is coming from maxillary. So they are coming from maxillary. You see, sir, maxillary doesn't have parasympathetic fibers, but you remember, maxillary has two communicating branches with the pterygopalatine ganglion. So pterygopalatine ganglion can send some branches, efferent branches, composed of the postganglionic parasympathetic fibers, onto communicating branches, 100 fibers each, I told you that. Two communicating branches, and these two communicating branches basically come from where? Maxillary. So these communicating branches have now some parasympathetic fibers in return now. So join the maxillary, and maxillary is giving one of the branches, that is called zygomatic. So all these parasympathetic fibers postganglionic will join the zygomatic. And zygomatic's one of the branches is the zygomatico-temporal. So these branches, you see postganglionic fibers, along with its sensory personal fibers also. These postganglionic fibers, which it has inherited actually from the pterygopalatine ganglion, has reached the zygomatico-temporal and communicating branches with these lacrimal. So these fibers will be handed over to lacrimal, so that lacrimal can actually safely hand these fibers over to the lacrimal gland for secretion purpose. So basically, the lacrimal gland, if it is secreting, who is doing it? Pterygopalatine ganglion. But pterygopalatine ganglion has the postganglionic, but who is giving this stimulus of the preganglionic stimulus. Preganglionic fibers to the pterygopalatine ganglion, they come from where? They are also coming from your posterior wall. In the posterior wall, there are three foramina. Big one, rotundum, then is small, that is called the pterygoid canal, then was the palatovaginal canal. Palatovaginal canal was for the pharyngeal nerve, rotundum was for the maxillary entry, but there was a foramen in between, that is called the pterygoid canal. Through that, the pterygoid canal is actually coming here a nerve, that is called the nerve of pterygoid canal. And this nerve of pterygoid canal contains preganglionic parasympathetic fibers also, but it is containing even sympathetic fibers also. But sympathetic which ones? Not preganglionic. All the fibers, if you are seeing in your head region, always call them postganglionic sympathetic fibers. They have a minimum, you see that their cell body present in your superior cervical ganglion. So, nerve of pterygoid canal contains sympathetic, postganglionic and parasympathetic, preganglionic, and you will be surprised, it will contain some taste fibers also. Three types of fibers are present in your nerve of pterygoid canal, a very important nerve, we will actually discuss it later. Okay, these are the branches, okay, 6 branches, 4 through the pterygopalatine ganglion and 2 separately. But what about the rest of the your maxillary nerve? I told you the rest of the maxillary nerve will enter into pterygomaxillary, into the inferior orbital fissure, which inferior orbital fissure is not present just in the infratemporal fossa through which your zygomatic nerve entered, but this this inferior orbital fissure is present more 10% in continuity in anterior wall of your pterygopalatine fossa. So, through that it will now enter to change its name to infraorbital nerve. So, you see infraorbital nerve is internal and is running on the floor of the orbit, and floor of the orbit basically is the roof of your maxilla also, a roof of your maxillary sinus also. So, if it is running in the floor, initially in the groove visible and then in the canal, little before entering into the canal, it is sending the branch through the floor to enter into the maxillary sinus. So, entering into the maxillary sinus. Now, you can watch this nerve entering into the maxillary sinus. So, that maxillary sinus, if it enters into the maxillary sinus, whose floor is formed by the hard palate, and through the hard palate the teeth are inserting. So, it is supplying now the teeth. Which teeth? Middle teeth, means premolars, or you can say some canines also. So, one canine will be and premolars also. So, you can call again dental nerve. Which dental nerve? Superior dental nerve. But which one? Posteriorly already you have seen directly from the maxillary, and this time this is called the middle superior alveolar nerve. Middle superior alveolar nerve, which has been given by the infraorbital nerve, which is nothing but the continuation of your maxillary just before entering into the canal. But just leaving now the canal and coming out of the infraorbital foramen, you see on the face here, it will give another branch, and this time that branch is in fact is running here, where again is penetrating the floor of your orbit, means penetrating the roof of your maxillary sinus, coming into the maxillary sinus, and the floor of the maxillary sinus is formed by the hard palate from where the teeth are coming. So, it is supplying the teeth. Which teeth? More anterior teeth. It will be supplying here the incisors. So, the incisors are supplying here. So, you will call this one also, you call also alveolar nerve. Which alveolar? Superior alveolar. But this time which superior? Anterior superior alveolar nerves. These nerves in fact here, the anterior superior alveolar and middle superior alveolar, these are the branches coming from the infraorbital nerve, which is the continuation of the maxillary. But the posterior superior alveolar nerve, very long nerve, that has been given directly from maxillary nerve when the maxillary was actually present within the pterygopalatine fossa. So, it actually left the pterygopalatine fossa through pterygomaxillary fissure to come into the infratemporal fossa to enter here into the back surface of your maxilla in the alveolar foramina to supply them. You see, so all these nerves, posterior superior alveolar, direct branch, and middle superior and the anterior superior alveolar nerve, they are actually coming here and supply the entire jaw. And the entire jaw, and they are even the roots, etc., and they are making actually kind of plexus, so they are interconnected also. So, through this entire course you have seen here, through the maxillary nerve you have supplied here the dura mater of your middle cranial fossa, you have entered the pterygopalatine fossa, 4 branches through pterygopalatine ganglion to your nasopharynx nasal cavity, oropharynx oral cavity. So, through the maxillary nerve you have seen here that it is actually during its intracranial course, extracranial course, and in the extracranial course the partly it was in the pterygopalatine fossa and partly it was in the orbit, and then came here onto the face here. In the face, in the orbit, its name was infraorbital nerve, but before that its name was obviously maxillary nerve. So, maxillary nerve, it was in the cranial cavity, then it was in the pterygopalatine fossa. Then it changed its name in the orbit, with the orbit change is the infraorbital nerve and the face also infraorbital nerve. So, in the 4 regions it is passing, and in almost all the regions it is supplying. You see, in the middle cranial cavity, in the middle cranial fossa, it was giving that meningeal branch to the middle cranial fossa dura mater. Then in the pterygopalatine fossa, it gave actually 2 communicating branches. Via that it gave 4 branches: sphenopalatine, greater palatine, lesser palatine, and palatovaginal, that is called the pharyngeal nerve. But the 2 direct branches also. One is called the zygomatic, that emerges outside here to become zygomatico-temporal and zygomatico-facial. And then another was posterior superior alveolar nerve for the molar teeth here, that came also. Both these nerves did emerge from the pterygomaxillary fissure to come into the infratemporal fossa, and then it will enter into the superiorbital fissure to form infraorbital fissure to form infraorbital nerve here. And infraorbital nerve in the orbit passing through, giving 2 branches down here to supply your middle teeth and the anterior teeth, middle superior alveolar, anterior superior alveolar. Then it comes to become now cutaneous here for your upper lip, lateral side, and the lower eyelid also. And huge division, you see that all this is present here. This whole distribution, you can say 4 regions it is actually crossing, and it's all these branches are being given here by the maxillary nerve.